Quinton Lucas, Mayor of Kansas City. Wanted to thank you all for being here today. We will be announcing a 12th amended order that handles a few different items in Kansas City relating to our response to COVID-19. The first things I want to note is how serious our COVID-19 challenge continues to be. Across our region, 135,000 people have tested positive for COVID-19, 32,000 of those people in Kansas City, Missouri. And across our region, 1,642 people have died of COVID-19, 373 of those in Kansas City. Our 7-day average, our daily average for deaths in our region in the first week of 2021 was 6.6, nearly half of the rate that it was in December of 2020. What that tells me is that our interventions have worked. Those interventions aren't just curfews, those interventions aren't just mask requirements, those interventions are also the fairly strict enforcement that we have done in Kansas City, Missouri, and I think we've been unique among jurisdictions in doing so. When we've heard complaints, we've closed down bad actors. When we've seen masks not being worn at indoor facilities where people are close, we've shut them down, we've allowed businesses to try to cure those problems. We will continue to do that. Nothing that we say or do today suggests that we're being any less serious about the threat of COVID-19. Nothing that we say or do today suggests that we're not still in a moment of crisis. And as part of that, we will extend our state of emergency in Kansas City until May 1st. I will say that I'm not one who likes to have a perpetual state of emergency, and I hope by that point we may be in a position where, while we're addressing the COVID-19 crisis long term, we're in a position to say that we don't need the same strict rules, we don't need some of the same emergency procedures. However, we are not at that point yet. The updated order that I'm discussing today will take effect at 10 p.m. today. One of the most talked about issues, and we've noted some of the changes around the region. In fact, I had a conversation with other jurisdictions both last week. I talked to a number of Johnson County commissioners yesterday. We will join the rest of the region with a midnight closing time. And within the month, we will review whether that closing time should either be extended or if that closing time should actually be more restrictive thereafter. As always, we will base it on science and data and facts. We've been heartened by the fact that after we issued our orders in November, and our goal was to make sure there weren't large crowds gathering during Thanksgiving, during the Christmas holiday, during the New Year's holiday, we've seen case rates among those who are ages 18 to 29 drop at almost 50%. Before that point, we had a crisis among those who were younger adults. We had a crisis because we saw crowds that were gathering at bars and at restaurants. Those interventions have worked, particularly during our significant holiday-related events. And so that is the reason, and indeed the only reason, why you're seeing some change in Kansas City's approach to the crisis now. We'll come back to you within a month, and we hope at that time we might be able to say that we can get back to business as normal. We'll go back to normal closing times in Kansas City. Indeed, that is my hope beyond all hopes. However, it will be based on how we're doing. It will be based on our hospital space. It will be based on infection rates. It will be based on fatalities we're experiencing in this area. As before, restaurants will be required to maintain social distancing between different parties and limit the number of occupants indoors to no more than 50% of building capacity. Indoor and outdoor patrons at these facilities, including bars, must be seated and masked at all times unless eating or drinking. And importantly, that seating requirement is important. We are not having big dance parties. We're not having some of those things that we've seen contribute to the spread. And restaurants, taverns, and bars, by virtue of direction of both this order and the Director of Public Health, must immediately report known cases of COVID-19 to the Kansas City Health Department. We're also continuing our limit of 10 people max for any indoor gatherings. And patrons of gyms, fitness, and recreational centers are still required to wear masks at all times in these establishments. A few other things I'll talk about: enforcement, vaccinations, and our business relief orders as well. Since our updated order went into effect in November, Kansas City's Regulated Industries Department has completed more than 315 inspections. And I will say this in credit to Kansas City and its order, because I don't think everyone has enforced the same way. When you have called Kansas City government with concerns about our enforcement apparatus, we have listened, we have followed up, we've made sure that there's compliance in every part of Kansas City. We will continue to do so. This includes 25 inspections that were made just last weekend, where 5 violations were found. Regulated Industries and our health department have been able to help businesses, importantly, develop compliance plans. Our goal is not to shut anybody down, but it's to keep patrons safe it's to keep our communities safe. In terms of vaccinations, the Kansas City Health Department has now received vaccinations this week and will be working importantly in the world of vaccinations. For us, the important goals are that we're equitable for all communities, that we make sure that we have vaccine rollout that's efficient and effective for those who are over the age of 65, for those who are in at-risk groups, and for populations that often have been hard to reach, including our Black and brown populations. I'll note that our Latino population has been disproportionately impacted both in infections and in fatalities in COVID-19. We'll make sure that we have significant outreach, and that's why I think the health department is so important. We will work with our hospital partners. We'll work with both our safety net institutions and more. But it's important as a health department that we do work to ensure that every Kansas Citian who needs access to the vaccine receives it as efficiently as possible. That will save lives. We will also make sure we continue our outreach in all populations to show that the vaccine is safe, to show that we'll be fair in how we administer. Our City Manager, Brian PLATT, will come up in just a moment to talk about our other efforts as it relates to large-scale vaccination facilities. As you know, in Kansas City, we are blessed to have several large facilities, a convention center, an arena I can see right now, and others. And we'll make sure that we're working with other organizations, both Veterans Administration, so many others, to make sure that we're looking to our long-term vaccination efforts. But I want to note two other areas. In business relief, you may remember that back in November, I introduced a proposal that directed the city manager to review all annual licensing fees for the Kansas City service industry, large businesses and small, and particularly with a focus on locally owned businesses, to identify fees that would be eligible for a deferral or reduction or waiver. Following that review, I'm excited that we have an ordinance that we will make available for you in just a few moments that will be introduced tomorrow, that's co-sponsored by a number of members of the City Council and I, that would provide any Kansas City business with annual revenues of less than $2 million. So any Kansas City business with revenues of less than $2 million to defer their license tax deadline payments until April the 30th or 60 days after the mayor's emergency order is rescinded, whichever is later. So for businesses that have annual revenues of less than $2 million, we've heard you. We've heard about the recent challenges, and we think it's important that we find relief for you. It's a deferral now, not a waiver, but we will continue to try to see ways that we can make sure folks can make ends meet, and some of that is not turning over $2,000 of payments to Kansas City government during the height of a pandemic. One other area that we've had much discussion on is how we can make sure we are reaching out to those in our unhoused population, those experiencing homelessness, both as it relates to COVID-19, but also as it relates to the fact that there are more people on the streets this year than perhaps we've seen in recent years. The City of Kansas City has contracted with a local hotel to provide rooms for people who need a place to live during the cold weather months between January the 11th, so it's already started, but running until April the 30th. So from today through April 30th, we will have a contract in place to provide housing for those who are experiencing homelessness during the COVID-19 crisis and during this current state of emergency. Several of the rooms will be available to be used as medical rooms and facilities for those who may not have regular access to physicians. Our on-site nonprofit partner at Hope Faith Ministries is helping the families move in and providing additional services. And they will be setting up a conference room as a learning center to make sure that those who are experiencing homelessness during this crisis still have access to so many of the services that are necessary during this time. We've heard from many of you, and we've heard about our treatment of unhoused persons during these cold weather months. We want to make sure that everyone has somewhere to go. We encourage anyone who is experiencing homelessness or anyone who is working as an advocate for those who are experiencing homelessness to reach out to Hope and Faith Ministries to make sure that you are letting folks know those opportunities for them. In addition, the city will continue to work with our federal partners to ensure that stimulus funding is spent efficiently and effectively to address both our housing crisis, to address our eviction crisis, and to address the many issues in Kansas City. We are still in the middle of an important public health crisis. That's why our order is extended. That's why we will require people to wear masks indoors in Kansas City well into the spring months and possibly beyond that. But we also recognize that there's a crisis relating to homelessness, a crisis relating to our small businesses, and we think today Kansas City government has taken important steps to address those issues. As I noted before, the city manager will come up to discuss our vaccination rollout procedures, and some of our efforts as it relates to large facilities. Our public health director will talk about many of our public health issues and crises relating to COVID-19. I'll come back with questions, as will Dr. Archer. Thank you.
Thank you, Mayor. Thank you, everyone. As we all know, the best lever that we have right now to end this pandemic is mass inoculation of the people of Kansas City and the people of this greater region. We're working on a vaccination plan at this point to ensure that not only we have widespread availability of the vaccine, but also that we are providing vaccination opportunities for all communities of the city, all neighborhoods of the city, and all corners of the city. The rate limiting factor that we're seeing at this point, as you may already know, is availability of the vaccine. It's been sporadic at best, which is causing a lot of challenges for us in distributing that vaccine. However, we're not waiting to develop our plan to make sure that once we have enough of a supply, we are able to distribute it and vaccinate our population as quickly and as in a widespread manner as possible. We will be, as the mayor mentioned, utilizing venues across the city, large and small, to make sure that we have adequate space. We're partnering with local and regional health organizations and community groups to make sure that we're utilizing the people and the staff and the resources that we have across the region as well. And I'm actually going to defer to Dr. Archer to provide a little more specifics on the details of this plan, but we're very excited about the possibility and opportunity for us to get a very quick handle on stopping this pandemic. Dr. Archer.
So you've heard some of the good news of where we're progressing. You've also heard the warnings that we're not there yet of where we need to be. I want to also take this time to remind people that yes, we have vaccine coming, but the number of people that need the vaccine versus the number of doses we have, we'll be lucky if we can do 1 out of every 500 that should be getting it for a while. It's going to take a while before these doses start rolling in. So we are rapidly gearing up so that we can do that once the doses are available. But when you go online and complete the survey, don't expect that you'll be contacted next week. We will be looking at the information. We will schedule. We're not going to have vaccines sitting around not getting into people's arms, but please be understandable and patient. But I also want to remind folks, if you've not heard this, you tell you for the first time, that once you are vaccinated, and that's 2 weeks after the second dose, your life actually isn't going to change very much. You may be a little safer to go to the grocery store. You may be a little safer in situations where somebody forgets to put a mask on. But we don't know yet to what degree the vaccine protects against you getting subclinical or low-grade infections that then pass on to other folks. So that science is still being looked at right now. What that means is you still need to be wearing the facial protection. And you may not be wearing it just primarily to protect yourself because you may be vaccinated, but you're wearing it now to make sure that you're still not spreading the disease because you've got it and don't know you have it. So all the measures, that's why the mayor's order is being extended to May 1. We know until we get quite a bit of community immunity, where there are a lot of folks that have been vaccinated, that, and then that's the other thing. I'm not real comfortable with a 95% protection rate if the virus is widespread and a lot of people are still getting exposed. So remember that. It may prevent you from dying, but if you get exposed at a high enough dose, you still could end up hospitalized. So you get the vaccine when you can get it, but understand that life is not going to change rapidly until we have an awful lot of people vaccinated.
For Kansas Cityans who are interested in signing up to indicate their interest in the vaccine, much like you've seen in other areas, you can go to kcmo.gov/coronavirus. kcmo.gov/coronavirus. That's for those who are interested in signing up for the COVID-19 vaccine. An important thing that I think we've continued to try to work with so many of our hospital facilities and others on, and the government will continue working on, is the fact that, as we all know, there are hospitals and other facilities that have had extra doses of vaccine. We want to make sure that there is a clear process by which folks who actually need the vaccine quickly, early in this process, are able to receive it. So we're working with our health partners to make sure that we're doing that. With that, I'll take questions. Dr. Archer will later. Don't worry about the wind. I'll start with you. Actually, I'll start with John. Yes.
I just wanted real quick on the survey, is that for residents only?
That
you work in Kansas City and complete a survey?
So for us, it'll be only for residents of Kansas City, and we really do encourage, and we'll make sure it's available in a number of different ways, but kcmo.gov/coronavirus. Ms. Kite?
Coronavirus is surging in Kansas City, cases are rising. Why is this the time to relax?
So a few different things. One, I think that it's really not the time to relax. The county executive, White, said something that I agree with fairly well, which is that none of us appreciate the fact that the regional consensus in some ways seems to have turned in a manner different than that which all of our health directors in 6 counties and a city had recommended back in November. That said, Kansas City is not on an island. I've said that before. We will make sure that we, unlike other jurisdictions, and I'll just say this, I think you can see from Kansas City we've done more enforcement than anywhere else. I understand in Johnson County, Kansas, for example, the district attorney has to be part of enforcement. I don't know how active they have been. We go out, we inspect bars, we make sure that rules are being followed, we make sure there's distancing, we make sure they're closing. So I guess I say all that to suggest that we will continue to make sure that orders are followed. We'll continue to make sure that safe practices, best practices are followed long term as well.
This is to match other jurisdictions, and why does that take priority over, why can't the city go in its own direction?
I don't need that, Joe.
Is it just to match other jurisdictions? Why does that take priority
Over Kansas City keeping the stricter...
Are other jurisdictions a priority over Kansas City's? I'm sorry, it's my hearing.
That's okay. Is this an effort to match Johnson County and other jurisdictions?
Oh.
Why is that important?
I actually had a conversation about this with some of those other jurisdictions recently. Is this an effort to match other jurisdictions? I do think you can say it's an effort that we get back to some level of regional consistency. I've, throughout this crisis, thought regional consistency was important for us. In a lot of my conversations with others, the City of Independence, Johnson County, Wyandotte County now, and Jackson County, I think there has been a goal for us, working with Clay and Platt County, who've stuck with us in this, to make sure that we have similar rules. People go across lines every single day. We do want to make sure that there is some clarity in what's happening, and there's clarity for businesses, and our treatment, our enforcement, and the rules that are laid out. Mike?
Mayor, how in talks with restaurant owners and people in that business, what did they tell you about the economic disadvantage Kansas City was experiencing because their closing hours for restaurants and bars were different? Very related to what Alec just said.
I think it is very fair to say that it was not economically advantageous that Kansas City restaurants and bars had to close 2 hours before others.
So did that push it?
No, but what I will say is everything that Dr. Archer and I discussed, others have discussed, is based on public health. So I will say this very clearly. Part of the reason that we went to a 10 o'clock closing time was that health directors in Johnson County, Wyandotte County, in Kansas City, Missouri, Clay County, Platte County, and others had agreed to this number. And so that was why we went to it. That's why we followed the order. I'm proud of the fact that Kansas City government followed the health director's recommendation at that time. I think what we're seeing now is some success relating to it. Kansas City, Missouri, compared to every other jurisdiction in this metropolitan area, I believe, at least as of yesterday, had a lower case infection rate per 100,000 than others, or perhaps we were tied or slightly below Jackson County, which also followed that rule and order. That has saved lives in Kansas City, particularly given the density of many of our areas and the number of at-risk groups that we have in Kansas City. And so in terms of why we are making a move today, we had all, as you probably well know, this order was set to expire on January 16th. Regardless regardless. I think you could say probably some of the moves that others have done relate to the fact our order was expiring, and we think that we've seen a lot of the progress. The other reason, in some ways, to Ms. Kite's question, that, and there, I've seen people ask already, how during this moment of crisis can we see some level of change? What we told the public back in early or mid-November was that we did not want to see large gatherings during the holiday season. I was scared of people going to crowded bars, crowded clubs, people coming back from school or from wherever else they live and being in packed bars in Westport or the Plaza or in Brookside. And I will say this in respect to Kansas City businesses, because a lot of those people who would have filled those bars didn't live in Kansas City, Missouri. I think we have made the entire region safer. I think our Kansas City requirements made this entire region safer by making sure that we had those rules. And the reason we had them was to limit the spread. And you've seen case numbers drop in the 18 to 29 age group. You've seen lives saved based on those important interventions. We understood the risk to businesses. We understood the risk to tax revenues in Kansas City, Missouri. But I'm proud of the fact that this city, our city council, and others have stood by those rules and requirements because we've made this region safer at times when other elected officials elsewhere weren't doing the same. Yes?
One other question. Weather notwithstanding, what's the thought on extending or making permanent the provision for sidewalk dining?
I'm exceedingly interested in making it permanent, that we have street cafes, that we allow a lot of the rules, both with liquor regulation, outdoor eating, street closures, available for long term. I think that next summer, when we'll still be fighting this pandemic, I would encourage those, for example, in Westport, to continue to consider keeping Pennsylvania closed to vehicular traffic, making sure that you have those open air opportunities. Frankly, it's good transit-oriented development. It's good for public health. It's good for our businesses, and I think it's a good way for reopening. Let me make another point relating to things that Kansas City's done. We've taken flack sometimes and how we've looked to different reopening procedures and practices. But if you look at our efforts at Arrowhead Stadium, I saw Dr. Archer get credit the other day, and I commend him for that. If you look at our efforts for reopening in terms of street cafes, we have worked hard to make sure that can be done, being a model both for this metro and I think nationally for what reopening can look like in Kansas City. And I think our ordinances relating to deferral of business fees for small businesses will be another model. Jordan, anything for you?
The blue line says they will continue with their lawsuit, even though you're giving them a little bit of what they want is to extend those hours. What do you have to say to that?
Well,
you want to stay open until 3 a.m.
Well, you know, here's the deal. Missouri courts, I think at this point, about 11 different times have upheld orders in Jackson County, St. Charles County, St. Louis County, the city of St. Louis, and throughout the state of Missouri. Judges have made clear time and again that public health orders that are made in the best interest of the public health of our community can be upheld consistently. In St. Louis County, those were relating to orders where bars and restaurants were closed entirely. In St. Charles County, Missouri, I believe that related to 11 p.m. closures. I am not concerned about lawsuits or threats of litigation. We have not been bullied by threats of litigation before. We won't now. My job, Dr. Archer's job, everybody's job is to make sure our community stays safe. Our public health consensus continues to be that crowded bars, late at night, when everybody's intoxicated, when people are less likely to follow the rules, when you're having more people that are standing around, will lead to a greater spread of COVID-19. I've heard stories, as all of you likely have, of how people who have had weddings, some in this metro area, or who have had events indoors, have led to outbreaks of COVID-19 even where they've had only 20 or 30 people. That's the reason why we continue to have these rules, these orders, and these restrictions. And look, there's a reason why, and you'll see it in our order today, that we will review this order on February 13th. I would love nothing more for everything to go back to normal as soon as possible. I want everybody spending money in Kansas City. But I also want everybody to live in Kansas City. I want everybody to be safe. I don't want to basically see some of the challenges we've had in this city and in this country. People are dying, people are being harmed, and that's why I fully believe that if they sue us and we have to walk across the street to the courthouse, we'll prevail in any litigation. Any questions here? Any others? Yes, Sharon.
Hi. So, just a point of clarity, or just to kind of expand what you said about people getting drunk and kind of doing what you can. So, extending this will give people a longer time to be in the bars and restaurants. And as we know, as that happens, people do lose their inhibitions and break the rules. So will there be increased enforcement with this?
Absolutely. So the question relates to increased enforcement. The answer is yes, there will be increased enforcement. One fortunate thing that has happened out of Washington, of which there aren't many, is that we are allowed to continue to use CARES Act funds to help address this crisis. We will continue to focus on enforcement activities both through regulated industries and the Department of Public Health. I can't make it any clearer. Our health inspectors, those in regulated industries, have worked hard under threat, by the way. This is not an easy job to do. But in Kansas City, they have gone to businesses large and small, bars large and small, and made sure these orders are enforced. I think that we have been very fair. We have worked with businesses, but we will make sure that mask requirements are being followed, that folks aren't standing up, dancing, having large events, and that we're not seeing the types of outbreaks that we've seen at weddings, funerals, other types of larger events indoors. And then we're not just having that happen at bars and restaurants. I'm proud of people 18 to 29. People said they wouldn't listen, but they did. And part of that was the enforcement of the rules that we had. And I'm proud of the fact that it looks like going forward, through our enforcement, we'll continue to do the same. That'll be it for me for questions. If you have any for Dr. Archer, then we'll go there.
Dr. Archer, how many doses of vaccine does the city have?
Right now we have 975. But remember that we're actually probably going to be able to get 1,100 out of that because you could squeeze extra doses out of each vial. And then as we get moving, we'll just keep ordering more and expanding. I wanted to get back to this issue of the extension to midnight. The White House reports to the states have been recommending closing the bars, period. But because we can't get that to happen at the governor's level in both states, we're faced with where we are. But let me just give you a little bit of an example. If you've got a second-story bedroom window, just because it's legal for you to jump out of that window doesn't mean it's a good idea. And I'm saying that because it's not a good idea to be in these indoor environments when people stop wearing masks. And if you're high risk, even if you've been vaccinated, these are not environments that I advise you to go to. It may not be mandated not to, but I want to be very clear that we're not at a point as a community that it's safe to be in those environments.
But doctor, doesn't the city also have a responsibility to protect the economic base of those small businesses? I mean,
absolutely, and I think that's part of this equation. The federal government ultimately should have protected those folks. And in other countries that did that, Australia and New Zealand, they're opened back up and safe and got the virus under control. So it's the lack of federal support to support not just the businesses, but even more importantly, the employees that work in those businesses that don't have paid sick leave and are in trouble because they don't have a paycheck right now. So it's both that are important, Mike. Yes? I am supporting the regional approach of moving to the midnight that the mayor has gone with the caveat that that doesn't mean that personally it's a good thing for people to take that risk. You know, this is restaurant week. Get all the carry out you can, support our restaurants, but don't do indoor dining. It's not safe yet.
Dr. Archer, the shipment of vaccine from Operation Warp Speed, will this help speed up the vaccination process, and do we know how much of that shipment KCMO is getting?
So there's no question that by freeing up the second dose as production gears up, there wasn't a need to hold all that back. So that part will be advantageous. We also understand that the incoming administration is going to basically use the War Powers Act to make sure that the various things that are needed to produce vaccine will be in supply. The failure over this last year was that by putting states against each other and local communities into bidding wars, it drove prices up and reduced supply, and that created all kinds of problems. So I believe that yes, when that War Powers Act is put in place, vaccine production will increase, plus we also have more vaccines that should be coming online.
Do you know how much of the shipment KCMO is getting from Operation Warp Speed?
Well, as I answered earlier, we have our first 975 dose. We have to order each week, and then we'll see what we actually get. One of the challenges has been that deliveries have not always occurred when they were said to be occurred, so it's a little challenging for us to give the public and the community a notice that we'll be vaccinating for these folks at this site when we don't know that the vaccine's actually going to come in. So there will be late notice of this, but that's part of why we're doing this survey instrument, so that we'll have people in a way that we can quickly send them an email to let them know that we actually can vaccinate them at a particular location.
You said yesterday, Dr. Archer, that the health department needs more people to administer the shots. CVS and Walgreens say that they're ready to help. Do you plan on using them to do this?
So this is an interesting issue of how this is rolled out. The federal government is paying CVS and Walgreens to administer vaccine, but they're not paying local health departments to do it. So now we think there's going to be money coming. We're in the process of trying to get that up and running. But we are going through a major effort now to get various volunteers that may be retired healthcare workers or various students that are in the healthcare field that are willing to volunteer. So we'll see how this gears up. But there's no question right now we have enough to be able to get out what we're getting. But as this supply starts coming, we will have to build additional capacity.
Are these vaccines going to be for people who live in Kansas City, Missouri, or work and live in Kansas City?
So our allocations are for the state of Missouri. In some cases where they are in certain categories of, like workers in a hospital, we didn't fight between Kansas and Missouri about if you work at, KU Hospital or you work at Truman, whose supply was going to vaccinate you. Each state gave the institution the vaccine, and residents from either state could be vaccinated. So we'll kind of see as we're working that out. We actually, as part of our coordination that we're looking at right now, we don't want to create extra barriers for folks, but we also want to make sure that our folks that are paying tax dollars in Kansas City, Missouri are getting that first opportunity.
Do you have any plans to use Arrowhead or the T-Mobile Center as a large vaccination place?
We have had several discussions on these locations, and I would not be surprised at all, but with the level of vaccine that we're getting now, it doesn't make sense to open up those operations. But yeah, we're not waiting until we get the vaccine to decide how we would do that. We're already structuring plans on how we would operate that way. And as an example with Arrowhead, we would combine with the Jackson County Health Department and coordinate together for Jackson County and Kansas City, Missouri residents.